You know, usually when we talk about like a medical diagnosis, there's this expectation of absolute precision.
Right, yeah. Like it's very binary.
Exactly. You break your arm, the x-ray shows a jagged white line, and the doctor just points and says, there it is. It feels almost like engineering, you know?
Broken or not broken. Very clean.
Yeah, but then you step into the world of actual health research, which is this massive, complicated process that leads up to all those clean medical decisions, and suddenly that x-ray machine is broken.
It really is. You're looking at a landscape that is honestly incredibly murky.
Right. It is the absolute definition of diagnostic muddy waters.
Because getting clear answers in health research means you're navigating a lot of human unpredictability, which means you need a very, very specific set of tools and rules.
And that is exactly what we are here to map out for you today. Welcome to the Deep Dive.
Glad to be here.
If you're gearing up for an exam or, you just want a rock-solid understanding of how health research actually works from the ground up, we have got you covered today.
Really?
We've got a whole stack of your multiple-choice questions, your MCQs, specifically from your Lecture 1, Introduction to Health Research Notes.
So we aren't just going to read an answer key at you. Right. Because knowledge only really sticks when you understand the why behind it.
Exactly. Think of us as your collaborative study partners. We're going to reason through these together.
I love that.
So here's how we'll do it. I will lay out the question number, the prompt, and all the options you might see on the test.
And then we'll kick around the logic.
Right. We'll lock in the correct answer, which, by the way, will be in bold in your transcript, and we'll translate the core concepts so you actually remember them.
No confusing jargon left unexplained. Just the architectural blueprint of how a good study is built.
Okay, so let's unpack this. Before we get into the heavy math or the research design, I feel like we need to establish what health research actually is.
Yeah, that's a good place to start, square one.
Because if I'm honest, my default mental image is just like scientists in lab coats peering through microscopes.
Oh, sure, the classic stock photo.
Right, but it's way bigger than that,
It's
isn't it?
much bigger. I mean, that lab coat image is part of it,
Yeah.
but health research spans this massive spectrum. It goes from a single cell under a microscope to a patient's bedside, all the way up to, like, sprawling community-wide government health programs.
Wow. Okay, so if it spans all the way from a single cell to a whole society, how do researchers even divide up their focus? Which actually brings us to question 1.
Let's hear it.
Question 1 asks, which of the following areas can be included in health research? And we have 4 Roman numeral statements here.
Okay.
Statement 1, improving the health of the population. Statement 2, predicting progression of a disease in a patient. Statement 3, prevention of various diseases. And Statement 4, to explore various societal, community-based, and programmatic interventions for disease prevention and control.
That's a lot of statements.
Right, and your options are A, I and 2, B, I and 4, C. All of the above, D. None of the above. Looking at those, I mean, it feels like they're all fair game based on what you just said.
You are spot on. The winner here is C, all of the above.
Okay, makes sense.
Yeah, health research operates at both the individual level, like predicting disease progression for one person, and the community level, like population health and societal interventions. It's essentially an umbrella term.
That perfectly aligns with question 26, actually, which asks, health research is usually focused on which of the following areas? A, estimation of disease burden in a population. B, prevention of common diseases in the community. C, evaluation of public health programs. D, all the above.
I'm sensing a theme here.
Right, it's got to be D, doesn't it?
Exactly, it's D, all the above. Because whether you are trying to figure out how many people have a disease, how to prevent it, or if a government program is actually working to stop it, it all counts as health research.
Let's apply that to a specific real-world scenario. Let's look at question 28.
Go for it.
Okay. A researcher wants to study the relationship between COVID-19 infection and pregnancy and birth weight. Currently, there is no evidence on this topic. Which of the following options is the scope of this health research?
This is a great question.
The options are A, verifying and confirming known information. B, getting additional or new information. C, evaluating ongoing programs. D, all of the above.
So the secret to this question is hiding right in the prompt itself.
Oh, where?
The phrase, currently there is no evidence on this topic.
Oh, I see.
Right. If there's no evidence, you can't verify what's known, so A is out.
Uh-huh.
And you aren't evaluating an existing program, so C is out. That just leaves us with B, getting additional or new information.
That makes total sense. So to gather all this incredibly diverse information, who is actually doing the heavy lifting?
Good question.
Question 20 gets into this. It asks, which of the following disciplines contribute to health research? A, biomedical research, B, biostatistics, C, social science research, D, all of the above. Now, I get biology and stats, but social science.
Yeah, people get tripped up by that one. But think about it this way. You can invent a miracle pill in the biology lab, right? And you can use biostatistics to prove mathematically that it works. But if you don't understand human behavior, which is the social science piece, people might just refuse to take the pill.
Oh, wow. Yeah, that's so true.
You need all three disciplines to actually improve human health. So that points us straight to D, all of the above.
The human element is the wild card.
Always.
Okay, let's get back to those lab coats for just a second to nail down some specific terminology. Here's question 21. Which of the following best describes a study done in a laboratory setting using animals?
Okay, let's hear the options.
We have A, translational research, B, bench-based research, C, theoretical research, D, preventative research.
So when you hear the word bench in science, I want you to picture a literal laboratory workbench, covered with test tubes and pipettes and beakers.
Ah, okay, so it's very literal. That makes our target be bench-based research.
Precisely.
And if you're taking what you found at that workbench and you're trying to figure out how to make it work in a complex community.
That leads perfectly into the next concept.
Right, which is question 17. Which of the following will best describe the scientific inquiry that seeks to understand the acceptability and functionality of a health program? A, basic science research, B, translational research, C, clinical research, D, implementation research, E, none of the above.
Remember that wild card of human behavior you mentioned earlier? That's exactly what this is addressing. You are studying how to actually implement a solution in the messy, real world. So the correct choice is D, implementation research.
I love how logical that actually is once you break it down.
It really is.
Okay, so moving into segment 2, the blueprint. We know what health research covers, but how do we actually build a study from scratch?
This is where it gets highly structured.
I feel like planning a research protocol is kind of like baking a cake. If you just throw ingredients in a bowl without a recipe or a plan, you're going to end up with a total disaster.
It's the perfect analogy. The planning phase is arguably the most critical part of the entire process. If your blueprint is flawed, the house will collapse no matter how good your building materials are.
So where is square one? Let's check question 27. Which of the following is ideally the first step in planning a research study? A, setting up the Institute Scientific Committee. B, calculating sample size. C, development of a study tool. D, framing the research question.
Well, before you can calculate how many people you need or design a survey, you have to know what you're actually looking for.
Right, you need a goal.
Exactly. So it has to be D, framing the research question. That is your absolute foundation.
And your motivation for building the house matters too. Question 29 asks, which of the following is not a critical consideration in planning a health research? A, adequate justification. B, clear and focused research question. C, standard case definitions. D, financial gain.
I really hope researchers aren't just in it for option D.
Seriously.
Thankfully, they shouldn't be. The outlier here is absolutely the financial gain. Your critical considerations must be scientific, justifying the study, having a focused question, using unambiguous definitions.
Makes sense. And obviously, you can't build it alone.
Yep.
Question 25 is a true or false. State whether true or false. Assigning roles and responsibilities to the team members is one of the fundamental principles of a research. A, true. B, false.
Oh, this is a resounding A. True. Having clear roles is the only thing that prevents total chaos once the data collection actually starts.
Now, what about the people we are actually studying? Because question 2 asks, what is appropriate for sample and sample size?
Let's see the options.
Should be representative of the population. External validity or generalizability. B, should be adequate power to draw meaningful inferences. C, both A and B. D, neither A nor B. This feels like a pretty heavy concept.
It is, but it's totally vital. Think of it this way. Representative means your sample looks like the real world.
Okay.
Like if you want to know how a drug affects all adults, you can't just test 20-year-old male athletes.
Right, that wouldn't be accurate for my grandmother.
Exactly. If your sample represents the real world, it has what we call external validity. But it also needs to be adequate, meaning you test enough people to confidently prove your point mathematically. That is statistical power.
So you need both the right mix of people and enough of them.
Yes. So the winner is C, both A and B.
Returning to our baking analogy, the people you include are basically your ingredients.
I like that.
So question 3 asks, Which of the following statements are correct regarding defining inclusion and exclusion criteria in a study protocol? A. They should be vague because this will allow greater and easy enrollment. B. They should be very specific. C. They should be very large in number. D. It is not important to define exclusion criteria in a clinical trial.
Well, if a recipe just asks for flour, and you use almond flour while someone else uses bread flour,
The cakes will be completely different.
completely different. Your ingredients need strict parameters. The same goes for research. So B, they should be very specific is the correct answer here. You must know exactly who is allowed in your study and who isn't.
So once we have the ingredients, we need the architectural design. Let's look at question 10. Which of the following is not a type of study design? A. Qualitative study. B. Observational study. C. Retrospective study. D. Pilot study. Looking at these, I'd assume a pilot study is a design, right? Like you're designing a test flight for your project.
It's a very common trap, but actually the correct answer is D, pilot study.
Wait, really? Why?
Because qualitative, observational, and retrospective, those describe the actual framework, the how of the data collection. A pilot study isn't a framework, it's a phase.
Oh, I see.
It's just a small-scale trial run of whatever design you've already chosen. You usually do it just to test your tools before the main event.
Oh, that makes total sense. It's a timeline thing, not a structure thing,
Good.
which actually helps a lot with question 23.
Let's hear it.
Which of the following is not a type of study design? A. Qualitative study. B. Observational study. C. Retrospective study. D. Translational study.
Exactly the same logic as the last one. Translational refers to the goal or the phase of research, moving an idea from the bench to the bedside. It's not a specific architectural framework. So we go with D, translational study.
All right, this brings us to segment 3, and here's where it gets really interesting. The gremlins of research.
Oh, yes. The gremlins.
Because even the most beautifully planned studies run into hidden gremlins that totally distort the data. We're talking about errors, confounders, and effect modifiers.
These are highly testable concepts, too. Because if you don't understand these gremlins, you simply can't accurately interpret the research.
Let's start with errors. Question 24. Which of the following statements is not correct regarding errors in a health research? Let's walk through the options. A. Random error is due to chance. B. Systematic error is due to bias. C. Random errors can be eliminated by improving study design. D. Bias distorts the study results in one direction.
Any initial thoughts?
Well, I feel like C is making a pretty bold claim about eliminating errors completely.
Good instinct. The incorrect statement, and therefore our answer is C, random errors can be eliminated by improving study design.
So they can't be eliminated.
No. Think of random error like static on an old radio station. You can't turn the static off. It's just part of the atmosphere. But by turning up the volume, getting a much larger sample size, the music drowns out the static.
Okay, and what about systematic error?
Systematic error, or bias, is different. That's like the radio dial being slightly off station. It distorts the music consistently in one direction. That is what you fix by improving your design.
That radio analogy is brilliant. So if we apply that volume control idea to question 16, what effect does increasing the sample size have upon the random error? A, it increases the random error. B, it has no effect on the random error. C, it reduces the random error. D, none of the above.
Well, by turning up the volume with a bigger sample size, the random noise basically cancels itself out. That points us directly to C.
Yeah.
It reduces the random error.
And what about that dial being off station? Question 11. Any systematic error in the design, conduct, or analysis of a study that results in an erroneous estimate of an exposure's effect on the risk of disease is called A, confounding, B, bias, C, interaction, D, stratification.
Whenever you see the phrase systematic error, bells should ring in your head immediately. The answer is B, bias. It means there is a fundamental, consistent flaw in how you are looking at the problem.
Now we need to talk about the trickiest gremlins. Confounders and effect modifiers.
These confuse people all the time.
Right. If we go back to baking, a confounder feels like a secret third ingredient that ruins your recipe without you knowing. Like, say you're doing a study to see if carrying a lighter causes lung cancer.
Okay.
The data might show a huge link, but the secret third ingredient, the confounder, is smoking. Smoking leads people to carry lighters, and smoking causes cancer.
That's the classic example, yeah. A confounder is a nuisance variable that affects both your study variable and your outcome, tricking you into seeing a false association.
Right. But an effect modifier.
If a confounder is a secret ingredient, an effect modifier is like the oven temperature. It actually alters how the ingredients interact. The relationship between your variable and outcome is real, but its strength changes depending on that third factor.
Let's test that out on question 9. What is true about confounders?
Yeah.
A, they affect both study variable as well as outcome. B, their effect can be minimized by proper study design and through stratified analysis. C, both A and B. D, none of the above.
Because confounders do, by definition, affect both the variable and the outcome, they are a total nuisance that you must actively eliminate or control for in your design. So the correct answer is C, both A and B.
And how do we spot these secret ingredients before they ruin the whole cake? Question 7 asks, which is the best source of information on effect modifiers while exploring cause and effect relationship in a research study? Deductive thinking. B, thorough review of literature. C, intelligent guessing. D, discussing with experienced researchers. I mean, intelligent guessing sounds really fun, but probably not great for science.
Definitely not. You do not want to guess. You want to see what other scientists have already discovered about the oven temperature, so to speak. And that requires a B, thorough review of literature. You anticipate the gremlins by reading the history of them.
Okay, let's look at an example with some serious medical vocabulary. Question 13.
Bring on the jargon.
A study was conducted to assess the extrapyramidal side effects of a new antipsychotic drug in patients with schizophrenia. Many of these patients were smokers, and some of them were on anticholinergic drugs. What was the role of the anticholinergic drugs in this study? A, confounder. B, random variable. C, effect modifier. D, independent variable.
Wow.
Whoa, right. Time out. Extrapyramidal side effects, anticholinergic. Before we try to guess the answer, let's translate that.
Fair point. Let's strip away the jargon. Essentially, we are looking at a new drug, and we want to know if it causes severe physical side effects like involuntary muscle movements. That's the extrapyramidal part.
Okay, involuntary movements.
But some patients are already taking another medication, an anticholinergic drug, which happens to calm those exact muscle movements down.
Ah, okay. So the other medication is actually changing how the new drug reacts in the patient's body. It's changing the temperature of the oven.
Precisely. The anticholinergic drug independently alters the outcome, the severity of the side effects. The relationship between the new drug and the side effects is totally real, but this other medication modifies how strong that relationship is for those specific patients. That makes it in C, effect modifier.
That makes perfect sense. Let's do one more to make sure this is locked in. Question 18. The following statements describe confounding and effect modification. Which of the statement is our correct?
Okay, let's hear the statements.
Statement A. In a study of relationship between coffee drinking and oropharyngeal cancer, smoking is a confounder. Okay, that sounds like our lighter example.
It does.
Statement B. In a study to explore relationship between hepatitis B infection and post-infection hepatic sequelae, habit of alcohol drinking acts as an effect modifier, and patients with this habit may be excluded from the study. And our options are A, B, C. A and B are correct, or D and B are wrong.
So you're right about statement A. Smoking is the ultimate confounder because it links heavily to drinking coffee and getting throat cancer.
Right.
And for statement B, alcohol actively changes the effect hepatitis B has on the liver. It modifies the biological outcome, making it worse. Researchers might exclude heavy drinkers just to get a clean look at the virus alone. So C, A, and B are correct.
Got it. Okay, moving into segment 4, the gatekeepers. You have your blueprint, you controlled for the static, and anticipated the gremlins. Now you need permission.
Yes, you do.
Let me ask you, if I just want to run a quick, harmless survey asking people about their dietary habits, do I really have to jump through a bunch of regulatory hoops?
You absolutely do. Yes, and they aren't just like bureaucratic hoops. They are essential protections for human life. Health research requires 3 distinct levels of review.
Which are?
Scientific review, to make sure the math and logic are sound. Ethics review, to ensure human subjects are protected from harm or coercion. And regulatory review, to manage legalities like money and international borders.
Okay, let's see how that looks on the test. Question 14. Before initiating the study, the principal investigator must ensure that various approvals are obtained. Which of the following approvals is absolutely mandatory? A, scientific committee approval. B, ethics committee approval. C, technical committee approval. D, regulatory authority approval. E, all.
Now, practically speaking, scientific, ethics, and regulatory approvals are all essential. However, based on the specific highlighting and focus of our source material here, the primary answer we are pointing to is B, ethics committee approval. Protecting human participants is the absolute non-negotiable heart of health research.
Question 22 hits that exact same note. Before initiating a clinical trial, A, scientific review. B, peer review. C, regulatory review. D, ethics review.
Once again, the most critical highlighted step right out of the gate is D, ethics review.
So what exactly falls under that ethical umbrella and what falls outside it? Question 12 asks, which of the following is not part of ethics review of a project? A, informed consent, document, and procedure. B, competence of researcher and institute conducting research. C, sharing and protection of intellectual property. D, pair and support during and after completion of research.
Well, ethics committees exist to protect human beings. Making sure patients consent, making sure researchers are competent enough not to hurt anyone, providing care, those are all deeply ethical concerns.
Right.
Arguing over who owns the patent or the intellectual property, that is a legal and business issue. Therefore, the answer is C, sharing and protection of intellectual property.
Speaking of legal and business issues, question 4, which of the following are examined as part of regulatory review? A, information regarding transfer of funds and utilization of funds. B, shipment of samples and transfer of data outside the country. Our source text actually cuts the options off there, so we'll just evaluate A and B.
That's fine, because based on the lecture slides, the standout function of a regulatory review, the thing government bodies care deeply about, is B, shipment of samples and transfer of data outside the country.
And at question 19 reinforces that exact concept. Issues regarding shipment of samples and transfer of data outside the country are examined by A, regulatory review, B, ethics review, C, scientific review, D, none.
Just to hammer it home, the answer is A, regulatory review. You can't just mail biological samples or sensitive patient data across international borders without government regulatory bodies heavily scrutinizing it.
All right, we have made it to our final segment, segment 5, real-world application.
The home stretch.
Let's look at a few examples of research out in the wild. And I should note, for you listening, questions 5 and 6 were omitted from our specific source text for this lecture, but we've got the rest covered.
Let's bring it all together.
Question 8. The policymakers want to know whether introduction of pentavalent vaccine in the national program is resulting in reduction in the number of Haemophilus influenza cases. Which of the following studies will they have to conduct to find an answer? A, case control study. B, field trial. C, ecological study. D, case series.
This goes back to our earlier discussion about scale. They aren't looking at a few patients in a controlled hospital ward. They are looking at a vaccine introduced across a massive national program.
Right.
To evaluate healthy people going about their daily lives in the real world, you need a B, field trial.
Very similar scenario for question 15. The policymakers want to know whether introduction of a new rotavirus vaccine in the National Immunization Program is resulting in reduction of morbidity and mortality from rotavirus disease. Which of the following studies will they have to conduct to find an answer? A, case control study. B, ecological study. C, field randomized trial. D, case series.
And again, evaluating a population-level immunization program requires stepping out of the lab and into the community. So the answer is C, field randomized trial.
Okay, our final question, question 30. The source text cuts off a bit, but we can definitely reason through it based on everything we've learned.
Okay, let's hear what we have.
Identify the correct statement about implementation of a research study. A, research findings must be approved by the funder.
Yeah.
B, research finding must be error-free.
Oh, we can stop right there, because we know for a fact option B is completely false.
Right, because of the radio static.
Exactly. The fundamental truth of health research is that it can never be completely free of errors. There's always be some random error, that atmospheric static, and there is always the potential for systematic error or bias.
So perfection isn't the goal.
The goal isn't absolute perfection. The goal is to predict and minimize those gremlins as much as humanly possible through rigorous design and sample sizing.
And just like that, we've reasoned our way through the core MCQs for Lecture 1. Congratulations on sticking with us through this intensive deep dive. We covered a massive amount of ground today.
We truly did. If we step back from the individual questions, the major takeaways are incredibly clear. Health research is a multidisciplinary effort.
Absolutely.
It requires a hyper-focused research question, the ability to anticipate confounders, and a deep, non-negotiable respect for the review processes that protect human subjects.
It's basically anticipating all the ways things can go wrong and planning against them.
That's a great way to put it.
So, what does this all mean for you tomorrow, beyond just passing a test? I want to leave you with a final thought to mull over. We just established that all research, no matter how beautifully designed, contains some form of inherent error.
Yep.
Knowing that, how should that change the way you read health headlines in the news tomorrow? When an article screams that a new, flashy study proves coffee cures everything, ask yourself, What invisible confounders or sample size issues or effect modifiers are hiding right behind that headline? Keep questioning, keep exploring, and we'll catch you on the next deep dive.